Everyone, welcome to Medcomplete board review. Today we have a 72-year-old male who presents to you for an annual physical examination. The patient works out 30 minutes 3 times per week. He eats a low-salt diet and has no medical issues. He has no family history of any malignancy. He underwent a colonoscopy 5 years ago, which was unremarkable. He does have a 15-pack year smoking history and quit when he was 50 years of age. Physical examination is normal. Which one of the following is most appropriate? Welcome back to Medcomplete board review. So the answer to the question that we posted earlier regarding our 72-year-old male who came in for his annual physical, the answer is D. Check abdominal ultrasound with duplex. So the reason that this is the answer is because this gentleman is above the age of 65. So any male who is 65 years or older who has any history of smoking needs to be screened for abdominal aortic aneurysm. The way we screen is by doing an abdominal ultrasound with duplex to look at the aorta, and we do that as a one-time screening, okay? So this is a recommendation for males only, so females who have a history of smoking, they are not as high risk to develop AAA, so therefore we do not screen them. Another indication to do abdominal aortic ultrasound is in any male 65 years of age who has a family history of abdominal aortic aneurysm. So that's another one you want to keep track of. So even if the male did not smoke, if he has a family history of AAA with rupture or repair, we should screen these men and do an ultrasound. In women with family history, the data is mixed. The answer on the exam will be to have a discussion about the risks and benefits, but it's not routinely done, okay? Colonoscopy here is the wrong choice because this gentleman had a colonoscopy 5 years ago and it was unremarkable, and he's average risk, which means he gets a colonoscopy every 10 years. So in his case, he does not require one now. Okay, CT low dose of the lung is something that I think we need to concentrate on a lot on the exam, because all they could have just changed a few of these numbers and this would have been also correct. So we do CT low dose lung cancer screening at the age of 55, okay? It's indicated for anyone, male or female, who has a 30-pack year smoking history. So our patient was a 15-pack year smoking history, so he does not require screening. The other reason he doesn't require screening is because he quit when he was 50 years of age, and he's currently 72. So anybody who quit more than 15 years ago does not require screening. So in other words, we screen people who have 30-pack year smoking history and have not quit within the past 15 years, okay? For abdominal aortic ultrasound, it's a one-time screening. For CT low dose, it's an annual screening. So we do CT low dose every single year in these patients until they quit for 15 years or become 75 years of age, whichever comes up sooner, okay? X-ray is not a recommended way to screen for lung cancer. It has been tested. It misses about 1/3 of malignancies in the lung, so it's not a good way to screen. And it does not reduce lung cancer mortality as opposed to CT low dose, which does reduce the mortality, okay? Digital rectal exam of the prostate. So this is not a recommended, it's recommended against this now. This is something that used to be done previously, but we do not recommend doing it for screening asymptomatic males. Okay, so if somebody is 72 and is asymptomatic, there's no reason to do a digital rectal exam because it has poor sensitivity and specificity for the detection of cancer. Now, if somebody is symptomatic, that's a different story. Then yes, you should do a digital rectal to examine the prostate in that case, in symptomatic individuals. PSA screening, in case that comes up, it's not going to be a clear-cut answer on the exam, just do PSA. It'll most likely say something like, have a discussion about the risks and benefits. And we'll have another question about PSA and why that is at a later point, okay? So I hope you found this helpful, and if you have any questions or comments, please leave them below.